Once again, this was supposed to be the first talk where I give an outlay and an overview about the principles and practice of setting up a new VR practice. So at the outset, I'll state that this is in no way trying to say that having your own practice is the best way to do it, or that is the end goal, or anything like that. People are comfortable in institutes or in charity hospitals, so each one to his own. But this instruction course, it was designed to give an idea to somebody who wants to start out, to talk about the nitty-gritties, to talk about the finances, to talk about the options. So when you talk about your own practice, the first question that comes up is, why? We are comfortable in institutes, but why would you even think of owning your own practice? The point is that you have the opportunity to provide growth to yourself and to people around you. You can change the economy around you, you can influence the community around you, and you can be an agent of change. And that is something that you can do when you have your own practice. But for that, you need to think differently from day one. As they say, the eye cannot see what the mind does not know. So you need to think and act like an owner from an early age. I would say from the days of your residency, you need to see everything differently and question things, by which I mean that, question the small things in your institute, in your place of work. Why is something placed where it is? What is the role of a particular person? Can that role be done differently? So you begin to question everything. You think like the owner, you take up responsibility. And when working in an institute, it's always natural that, I have my fellows who say, no, sir, I'd like to work with the Lumira 700 alone. That's where I can see. I say, no, you work with the Lumira, you work with the Topcon. Work with different ranges of machines, know them well, and you need to know what the value of money it offers. Let's say there is a machine that costs 20 lakhs. There is the same machine that costs 10 lakhs. So you have a difference of 10 lakhs, but what is the value that the 10 lakh difference is going to give you? And we need to be very clear about that. Talk to your consultants or your assistants or your professors in your residency days and know the difference, know the value for money. And something that we don't concentrate on until we buy a machine is the operating costs. So just getting a machine is not the end of the story. It's going to give you recurring expenditure. It's going to give you consumables like assets and tubings and so on and so forth. So you'll have to be comfortable. You need to know the operating costs of a particular machine. And then after coming out of an institute, real world experience counts a lot. By which I mean, our institutes are really huge and we are a small part in that big chain. But when you come out, you need to work in or get experience in a place, in a scale that you envision for yourself. If you think that I'd like to have this kind of a setup, go work there. See how they actually multitask, because in an institute, multitasking may not have been there. You'll have specified people for specified roles. So in a private practice, in a small setup or in a startup, multitasking is very important, and that's where you can manage costs. So you need to have real world experience. And coming to money, it's a touchy topic for most of us, but especially when you're starting out, you need to have an honest discussion with family, sit down and see what they have and what they can contribute towards our startup. We'll usually be surprised by what we have, or actually what we don't have. And if the expectations don't match, then you begin to talk about going out for a loan. What are the interest rates? What are the collaterals that you'll need? What is your CIBIL score? And if all of this is not matching, then you might think of unsecured loans from your friends or relatives. And this is something that I'd like to stress upon. The economic impact of our actions. As doctors, we're not really aware of the economic impact of the actions and what we do. So I'd like to say that the charges that we charge a patient are X and our expenses are Y. The difference between X and Y is what is going to run the show. X is usually determined by the market. We can't play with X much, but Y is something that we can tweak around, that we can optimize. So doing the optimization in Y is going to give your revenue. So you need to know the costs involved in a particular surgery, and you'll have to be very, very clear about the consumables used, be it on a large scale or on a small scale. That is going to give you your revenue. Then I say network with people, build lasting relationships. I have learned the science of ophthalmology from doctors and senior professors, well-respected people. But I've learned the business of ophthalmology from a lot of other people, right from the watchman at the door to the OT technician, from an unhappy patient to the aggressive, insurance guy who wants to squeeze us. So everybody has something to teach us. We'll have to keep our mind open and learn from everybody, and that's very, very important for a startup. And besides the science, you need to know your infrastructure, tools, and quick fixes for everything. For example, last week I was operating on a VR case. The power went off. The guy who was supposed to be there switching on the generator was not available. So I had to stop. I had to go out, switch on the generator, come back in. Now that's not the ideal thing to do, but you'll have to know, and you'll have to be the last man who will at least do and get the job done, because the show should go on. I remember about 20-25 years back when my dad taught me how to ride a bike. The first thing he taught me was how to fix a flat tire. Only then he taught me how to ride a bike. So you need to know quick fixes because the show should go on. Man management skills are very important. I say, hire for aptitude and then train for skill. We'll have to adapt to changing needs, and in that process we'll be losing a few people. That's okay. We ourselves will have to unlearn and relearn a lot of things, and that's something that we don't do because unlearning and relearning becomes difficult with age. The entire drive is that leadership is about vision and responsibility. You're creating something, so that drive would always be there. When it comes to hierarchy, the needs and priorities of the organization are paramount. The needs and priorities of the organization are paramount. Then the employee, take care of your employee, the employee will take care of your client. Finally, the leader comes. The leader is the first to step in case there's an adversity, and he's the last to take credit for anything that goes well. These 4 A's are something that I stress upon always when we're talking about a medical practice, in that order: accessibility, availability, affordability, and appropriateness. Now we'd like to think that something that we do is very unique, for example a phaco or a VR surgery, but if we step back and think, it's not that unique. Anybody can do what I'm doing. Given he's got adequate training, moderate training, he can do what I'm doing, and 6 days after surgery the results are also more or less equal. So what I am doing, anybody can do. So look at it from the patient's perspective. I'd like to approach this doctor if he's accessible, if I can go and approach him from my home without too much hassles, if he's available most of the time. So these two would rank really high. And if there is one thing that a business leader or somebody into business will tell to you about retail services, that is location. Location, location, location. You need to know where you're sitting. You are selling a product, and does the community in that location need your product? It's called the product market fit. Does your product fit with the needs of the market there? So in analyzing this, it's important to remember that it's okay if you move out of your comfort zone. This is not about our interests or where I want to be. It's about the organization again. The organization should grow, and so the product that is sold by the organization has to be in the right place. Finally, we are in the business of dealing with people. So the person sitting across the table, he's not interested in knowing my scientific degrees, knowing what all I can do. He is interested to know if I can help him, if I can, help him alleviate his suffering, if I am genuine. So how genuine am I? And the best way to do that is to listen. Because the needs, perspectives, the thinking of people in different communities are different. So I need to understand that. I need to understand what his needs are, and in doing that, I need to listen to him. When I listen to what he's saying, I know what he wants. When I know what he wants, I can, give him relevant solutions, comprehensive solutions in a holistic manner, and that's what most of our patients want. And when you do this on a consistent basis, word gets around, your practice grows, and when you are self-sufficient, you can come back to science. Science and academia then form the icing on a well-baked cake. So time is the real currency. I'd like to stress this. Time is the real currency and our most valuable asset. So when you own your practice or when you have your own setup, you have your own, you control your most valuable asset, and you go through a lot of trials and tribulations that makes you a better person, both physically and mentally, and you carry that forward into other spheres of your life. So I'd like to close with this line in Tamil from the Masters of Tamil Music. It says, Pudu Ragam Padaipadale Nanum Irevane. A loose translation would be, if somebody who creates is God, then I'm God. Well, that's a little too extreme, but you can say that, you have the satisfaction of creating something and being known after you've gone for the values that you stood for, giving people opportunities. So the most reliable way to predict the future is to create it. And so, welcome to the world.